The chair recognizes the gentleman from Connecticut, Mr. Courtney, for 5 minutes.
Thank you, Madam Speaker. Madam Speaker, after an extraordinary lengthy recess that Speaker Johnson ordered at the third week of July, Congress is finally back in session with a huge to-do list. If there was any benefit in terms of having members back home, though, it was an opportunity to go out and listen to what's on people's minds. Town hall meetings, community gatherings offer, again, members of Congress a chance to listen to people in terms of what they care about the most. And I had a number of those events in Mansfield, Connecticut, Colchester, Connecticut, Old Saybrook, Connecticut, with very packed rooms. And the issue that was of most concern was HR1, what President Trump calls the one big, beautiful bill. While we were away, the Congressional Budget Office had a chance to finally zero in on final numbers in terms of the impact of HR1, the one big, beautiful bill. Again, it was being written over and over again and changing up until the final minutes, but they finally got some clarity. And what they determined was that the number of people who will lose their health insurance coverage because of HR1 is 10 million. 7.5 million of people on Medicaid and another 2 million people who get their insurance through private health plans on the exchange. They also calculated the debt impact in terms of HR1 because of the massive giveaway to billionaires in the top 1% of this country. And they determined that, again, the bill is going to add $3.4 trillion to America's deficits between 2025 and 2023. The debt service on that additional debt is an additional $718 billion. That's just pure interest, has no value in terms of services or programs that actually help the American people. Because of that debt figure, the bill triggered another law called PAYGO, the Pay-As-You-Go law, which was passed in the 1990s, to put pressure on Congress not to pass legislation with that big of a deficit impact. Unfortunately, the majority ignored the PAYGO rule, and what CBO told us on August 15th is that will trigger automatic cuts to other programs. That's the way the PAYGO law was designed, to, again, create some deterrent on Congress from excessive deficit spending. And the Medicare program, the program that helps people over age 65, is the one that's going to take the hit, a 4% across the board, $45 billion PAYGO cut because of this measure. Now, in addition to those numbers, what we're also hearing about is from the groups that are going to be impacted. Madam Speaker, in this morning's Connecticut Press, there's a story, What Worries Connecticut Hospital Leaders, about Trump's big, beautiful bill, which I would ask to be admitted to the record. Thank you, Madam Speaker. And again, this article went out and interviewed hospitals across the state, urban, rural, suburban. And what all of them are reporting is that the hit of $1 trillion of Medicaid is going to ripple through the system and cause impact for everybody who, again, relies on those critical services. Dan Keenan from Trinity Health Services, St. Francis Hospital in Hartford is one of their big members. I was born there a number of years ago, stated, the impact goes far beyond those who lose coverage. Our entire health system and every community we serve will feel the effects. Reduced services, longer wait lines, staff reductions, and potential closures of programs and facilities. He pointed to emergency rooms as an example. When people don't have coverage, they turn to emergency rooms for basic care, resulting in crowding, service delays, and staffing issues that will impact the entire system. That affects everyone, and it will spill over into people's employer-based commercial insurance premiums, which again, the article goes through in great detail. Madam Speaker, President Trump the other day said he actually doesn't think he wants to call the bill the one big beautiful bill anymore because, as he said, it was good for getting it approved, but it's not really good for explaining to people because people have figured out enough in terms of deficit impact, taking away people's health insurance coverage, and the impact on services, particularly in the hospital sector, which they warned us about before the bill was passed, and yet the majority in the White House turned a deaf ear. We have a lot of work to do when we get back into town starting tonight. And again, one of them would be nice is if all the members who had town halls, and I know Republicans heard about this as well as Democrats, that we recognize that this bill is not the 10 Commandments, We have the ability, we have the legal authority to make changes and listen to the people who are warning us that it is actually going to harm the American people, and there is nothing beautiful about it. I yield back.
During remarks on the House floor, Representative Joe Courtney, DCT, criticized the Trump administration and Republicans over the proposed health care cuts in the reconciliation package. After an extended recess called by Speaker Johnson in July, Congress had returned to session with a long to-do list. Courtney explained that while being back in their home districts, members had the opportunity to hear directly from their constituents, which he said was invaluable. During town hall meetings across Connecticut, the most pressing concern expressed was the potential impact of HR1, a bill President Trump had referred to as the One Big Beautiful Bill. Courtney pointed to the findings of the Congressional Budget Office, CBO, that finally clarified the bill's financial ramifications. According to the CBO, the bill would result in 10 million people losing their health insurance coverage, 7.5 million from Medicaid and 2 million from private health plans purchased through exchanges. The CBO also calculated that HR1 would add $3.4 trillion to the deficit from 2025 to 2033, with an additional $718 billion in interest payments. This massive increase in debt triggered the pay-as-you-go (PAYGO) law, which was designed to discourage such deficit spending. The law mandates automatic cuts to other programs when a bill's deficit impact is too high. As a result, Courtney noted Medicare, the federal program providing health coverage to seniors, would face a 4% cut, amounting to a $45 billion reduction in funding. This would have a significant effect on the nation's healthcare system, especially in Connecticut, where hospital leaders had already voiced concerns. According to a report in the Connecticut press, hospital leaders from across the state warned of the detrimental impact the Medicaid cuts would have. Dan Keenan from Trinity Health Services, which oversees St. Francis Hospital in Hartford, stated that the bill's impact would go beyond just those losing coverage. He predicted that the cuts would result in reduced services, longer wait times, staff reductions, and even the potential closure of programs and facilities. Courtney further explained that when people lose health coverage, they often turn to emergency rooms for care, putting additional strain on hospitals. This creates a ripple effect, with delays in services, overcrowding, and an increasing burden on healthcare staff. These impacts would eventually spill over into the broader healthcare system, driving up the cost of employer-based commercial insurance premiums, which would affect everyone, not just those directly losing coverage. In response to mounting concerns, President Trump recently remarked that he no longer wanted to call the bill the One Big Beautiful Bill, admitting that the term was useful during the bill's passage but had since lost its appeal. Trump acknowledged that people had started to recognize the bill's negative consequences, particularly the cuts to health care, the rising debt, and the potential harm to critical services. Despite these warnings, Courtney emphasized that the White House and congressional leadership had ignored the concerns raised by hospital leaders and constituents alike. As Congress reconvenes, Courtney called for lawmakers to reconsider the bill's provisions. He stressed that HR1 was not set in stone and that there was still time for Congress to make changes in response to the public's concerns. The health care cuts, he argued, would harm the very people they were elected to serve, and it was crucial to take another look at the bill before moving forward.